Dave here, Wellness and Health Promotion Manager at DCare, and today we're answering some of your Ask the Expert questions that came in through our new feature. So one of the ones that came in was, can you floss too much? Generally speaking, you should brush twice a day, in the morning and in the evening before bed for 2 minutes a day with a 1450 part fluoride toothpaste for over 2s and above. Flossing should be done particularly kind of just in the night time, maybe in the evening. Generally speaking, I would floss first, and get it from your elbow to your wrist, around your two index fingers, and down one side of the tooth and straight back up the other side. I would floss first because sometimes there can be a little bit of bleeding and in between the gums, and then brush with the fluoride toothpaste and leave the fluoride, spit, don't rinse, and it's there for through as you're sleeping as well, and the fluoride is there for protection because we're not having any drinks or washing it away or anything as we're going to bed at night. The second part of the question that came in was gums being red, swollen or bleeding. Generally speaking, your gums, if you touch them in front of a mirror, they should blanch, they should go a little bit white. Gums should be pink, firm, healthy to touch. If they're red or inflamed, generally it's the first stage of gum disease, which is reversible, called gingivitis. Generally, if your plaque food lingers in the gums and forms this plaque biofilm, and anything after eating from about maybe 6-12 hours, if it's not brushed away, your body reacts by sending loads of white blood cells, loads of blood to the area full of leukocytes, white blood cells that fight off infection. So to become a little bit puffy and swollen, and what tends to happen is, that's the first stage, a bit of inflammation. Generally then what happens is it leads on and progresses over a period of weeks to months, if there's inaccurate oral hygiene, and what tends to happen is a gap forms between the gum and the tooth, and plaque and food form down and form a pocket, and that goes on then to what we call periodontal disease, which is gum disease with pockets. So again, I would really just urge you to go to your dentist regularly, keep your hygiene checks twice a year. It's really important. Oral hygiene is specific to the person, so your dentist will tell you how often you need to go and how good your oral hygiene is. Again, it's very it's not so simple, but it's you're looking at your sugars, your diet, any underlying medical conditions, hormones, stress levels, bruxism, grinding, dry mouth like serostoma, any medications that you might be taking, and then as well as your diet and sugars, the type of toothpaste you're using, fluoride, how often you're brushing your teeth, flossing, and the technique that you're using while brushing your teeth as well, all play an impact on your gum and your gingival health. So I hope that's helped to answer some of your queries. What I would generally do is the chlorhexidine mouthwashes. There's lots of different things you can use, but generally speaking, I would go to your dentist and just book an appointment and have a consultation, just so remember, it's not just the teeth that are looked at, it's our gum health, it's the gums, the ligaments, and the bone, your alveolar, your jawbone, that are all checked as well. So that can be done in a routine.